Simply by changing your sleeping position to the left side, your life could turn to a healthier new chapter. That is right. It may sound simple, but behind this small habit lies astonishing medical secrets that many people have never heard before. From improving digestion, boosting cardiovascular circulation, to supporting the body's natural detoxification process. All of these benefits can start just from changing the direction you sleep. But that is only the tip of the iceberg. Recent studies have revealed that sleeping on your left side may help slow down the aging process, prevent age-related diseases, and even extend your lifespan. What is even more special is that only those who consistently practice this habit every night will truly experience these remarkable changes. Before we dive into these fascinating facts, I invite you to leave a positive affirmation for yourself in the comments below. Something like, "I choose to take care of my health, starting with the smallest habits," or any beautiful wish you want to plant for yourself. And do not forget to like the video and subscribe to the channel so you will not miss any valuable content like this. Let us build a vibrant, positive community together to stay healthy, peaceful, and happy for a long time. Now, if you are wondering, how could simply changing sleeping positions have such a powerful impact on health? The answer lies in the very way our bodies were designed by nature. The human anatomy is not perfectly symmetrical. The heart, stomach, spleen, and most of the digestive system are skewed toward the left side of the body. Therefore, when you lie on your left side, natural gravity optimizes the functioning of these organs. The heart does not have to work as hard to pump blood upwards. The stomach digests food more easily and moves waste toward the colon more smoothly, while the spleen, the body's blood filtering and immune supporting center, also functions more efficiently thanks to its favorable position. And that is not all. The lymphatic system, which carries cellular waste and toxins out of the body, primarily drains toward the left side through a duct called the thoracic duct. When you lie on your left side, lymphatic flow becomes more open and gentle, allowing the body's natural cleansing processes to happen much more smoothly and effectively. Another important point is that the inferior vena cava, the main vein that returns blood from the lower body back to the heart, runs slightly to the right. By lying on your left side, you reduce pressure on this vein, making blood circulation easier and reducing the risks of blood stagnation, swelling, or even thrombosis. So, this is not about superstition or vague traditional habits. This is a scientific and silent gift you give your body each night, easing the burden on your heart, enhancing liver detoxification, promoting smoother digestion, and nurturing overall health naturally. Right after this, I will reveal 7 surprising truths that science has uncovered about the benefits of sleeping on your left side, and I believe you will be even more amazed. One of the clearest benefits of sleeping on your left side, though little known, is that it helps the liver detoxify better at night, the time when the body enters its strongest phase of recovery and regeneration. The liver is often referred to as the body's largest blood filtration plant. Each night, as you sink into deep sleep, the liver gets to work, filtering out toxins, metabolizing waste products, balancing blood chemistry, and producing bile for fat digestion. However, few people notice that the liver is located toward the right side of the body, while the bile duct, the pathway for bile to exit the liver, leans toward the left. Therefore, when you lie on your left side, gravity helps bile flow more easily from the liver into the gallbladder and the digestive system. This relieves pressure on the liver, supporting a smoother and more efficient bile secretion process. A steady bile flow not only aids fat digestion, but also speeds up the elimination of toxins stored in the liver, reducing the risk of gallstone formation and liver dysfunction. Recent studies also show that sleeping posture can affect blood flow through the liver and the effectiveness of metabolic processes. Sleeping on the left side allows blood to circulate more freely through the liver, boosting its blood filtering capacity and lessening the organ's workload, especially during the peak detoxification hours from 1 o'clock in the morning to 3 o'clock in the morning, according to the body's natural biological clock. Another crucial point is that when the liver works efficiently, the entire body benefits. Better waste elimination and toxin filtering help you wake up feeling lighter with a clearer mind, smoother digestion, and healthier, more radiant skin. Another significant advantage of sleeping on your left side is its potential to help prevent Alzheimer's disease, a growing concern as people age. Recently, scientists have discovered a special mechanism in the brain called the lymphatic system. This is the brain's waste drainage system responsible for removing harmful toxins and excess proteins like beta amyloid and tau, which are major contributors to the development of Alzheimer's disease. The lymphatic system mainly operates at night during deep sleep. Interestingly, sleeping position greatly influences the efficiency of this system. Animal studies and MRI imaging on humans show that when sleeping on the left side, the cerebrospinal fluid, the main medium for clearing brain waste, flows more robustly. In other words, sleeping on your left side helps the brain cleanse itself more effectively, removing accumulated toxins and thereby reducing the risk of amyloid plaque formation, an early marker of Alzheimer's. Furthermore, sleeping on the left side improves brain blood circulation, supplying oxygen and nutrients steadily to neurons. This is crucial for maintaining cognitive function, memory, and reflexes as we age. Although research on the connection between sleeping position and Alzheimer's is still expanding, early results are extremely promising. A simple act like adjusting your sleeping position could become a key part of a long-term brain health strategy. A very practical benefit of sleeping on your left side that you can quickly feel is its ability to reduce the risk of acid reflux, a common digestive problem, especially after large dinners or among older adults. The explanation is simple yet highly convincing. When you sleep on your left side, your stomach is positioned lower than your esophagus, the tube that carries food from the mouth to the stomach. Naturally, the stomach has a curved shape that leans to the left. Lying on your left side allows gravity to help keep food and acidic stomach content settled at the bottom of the stomach, limiting the chance of acid flowing back up into the esophagus. Conversely, if you sleep on your back or right side, the stomach can sit higher than the esophagus. In that position, acid and food can more easily travel backward, causing a burning sensation in the chest, sour belching discomfort, and even waking you up in the middle of the night with breathing difficulties or persistent coughing. Many studies have confirmed that sleeping on the left side can significantly reduce both the frequency and severity of nighttime acid reflux episodes. This is particularly important for those suffering from chronic gastroesophageal reflux disease, pregnant women, people with obesity, or those who often eat late at night. Not only does this habit reduce uncomfortable symptoms, but it also protects the esophageal lining, helping to prevent ulcers and more serious complications like Barrett's esophagus, a known risk factor for esophageal cancer. The simple habit of lying on your left side after dinner, especially during the first few hours of sleep, will help your stomach digest food more easily, keep acid in its place, and protect your esophagus safely. Sleeping on your left side is not only beneficial for digestion and brain health, but also plays a crucial role for pregnant women, especially during the later months of pregnancy. During pregnancy, the uterus expands to nurture the baby and increasingly presses against the internal organs and blood vessels. One of the most important affected vessels is the inferior vena cava, the vein that returns blood from the lower body to the heart, which notably runs along the right side of the spine. If a pregnant woman sleeps on her back or right side, the weight of the uterus can directly compress this vein, obstructing blood flow back to the heart. As a result, the blood supply to the placenta and baby can decrease, reducing the amount of oxygen and nutrients the baby receives to grow strong and healthy. On the other hand, sleeping on the left side gently shifts the uterus off the inferior vena cava. Blood flow from the lower body back to the heart becomes smoother, and most importantly, oxygen-rich blood and essential nutrients are delivered more fully to the placenta and the baby. Many obstetricians recommend that starting from the second trimester, and especially in the third trimester, from week 28 onward, pregnant women should practice sleeping on their left side to optimize blood flow to the fetus. Additionally, this position helps the mother feel more comfortable, reducing leg swelling, easing back pain, minimizing pressure on the kidneys, and improving overall circulation. Of course, it is not always possible to maintain one position throughout the night. But even prioritizing sleeping on the left side for the majority of the night can already bring significant benefits to both mother and baby. Another quiet but extremely important benefit of sleeping on your left side is the improvement of lymphatic circulation efficiency. The lymphatic system is a network that spreads throughout the body, including lymphatic vessels, lymph nodes, and lymph fluid. Its role is similar to a natural drainage system, helping to transport cellular waste bacteria, viruses, and toxins out of body tissues for elimination through the liver, kidneys, and excretory system. A well-functioning lymphatic system means a stronger immune system and a body that is cleansed from the inside out. Interestingly, the structure of the lymphatic system is not entirely symmetrical. About 75% of the lymph fluid from the entire body drains into the thoracic duct, a major duct that leans to the left side. This thoracic duct collects lymphatic fluid from both legs. The abdomen, most of the chest, and the left arm then empties it into the bloodstream via the left subclavian vein. When you sleep on your left side, natural gravity supports the flow of lymphatic fluid in the correct direction, making it easier, faster, and less likely to become stagnant. This helps optimize the process of removing harmful waste from body tissues, reduces the burden on the liver and kidneys, and enhances the body's natural immune defense. Conversely, if you sleep in less favorable positions such as lying flat on your back for too long or sleeping on your right side, lymphatic flow may slow down, leading to fluid retention, swelling in the hands and feet, a heavy body feeling, and over time the buildup of toxins that could negatively impact overall health. Optimizing lymphatic circulation not only brings short-term benefits, like waking up feeling lighter and more refreshed, but also plays a long-term role in protecting the body from immune system disorders, infections, and even certain types of cancer. If there is one particularly compelling reason for you to consider sleeping on your left side every night, it would be the positive impact on cardiovascular function, the very center of life operations in the body. Our heart does not just pump blood to nourish all organs, it also constantly battles gravity, especially when returning blood from the lower body. One of the largest veins that supports this task is the inferior vena cava, which is positioned slightly to the right of the spine. When you sleep on your left side, the weight of your internal organs reduces the pressure on the inferior vena cava, allowing blood from the lower body to return to the heart more easily. The heart does not have to work as hard to maintain stable circulation. This is especially crucial for people with heart conditions, particularly those suffering from congestive heart failure, a condition where the heart can no longer pump blood efficiently throughout the body. In clinical studies, it has been observed that reducing external pressure on the inferior vena cava can help improve blood pooling in the lower limbs, reduce swelling, and help heart failure patients sleep more comfortably. Moreover, the left-leaning position allows the heart to rest in a slightly downward, more favorable orientation compared to other organs, supporting blood pumping more naturally with the aid of gravity. Smooth blood circulation reduces internal pressure within the heart chambers, limiting the risk of myocardial stretching, a factor that can worsen cardiovascular disease over time. Even for healthy individuals, giving the heart a bit of a break for 6 to 8 hours every night yields long-term benefits. The heart gets some relief. Blood circulation remains steady. Body tissues receive sufficient oxygen and nutrients, all of which create a solid foundation for lasting health. If you have ever felt bloated, heavy, or uncomfortable after dinner, sleeping on your left side might be a simple and highly effective natural solution to ease these issues. The body's digestive process follows a certain direction and is directly influenced by gravity. After food is partially digested in the stomach, it moves into the small intestine where nutrients are absorbed, then through the ileocecal valve, the gateway between the small intestine and large intestine, and into the next phase of digestion and elimination. Notably, the structure of the small intestine, the ileocecal valve, and the large intestine all tend to align toward the left side of the body. When you sleep on your left side, Gravity naturally supports the smooth movement of digested food from the small intestine into the large intestine. This reduces pressure within the digestive system, helps prevent slow digestion, bloating, and decreases the risk of constipation. Common issues, especially as we age or after heavy protein-rich or greasy meals. In addition, sleeping on the left side also helps the stomach and pancreas function more easily. The stomach positioned lower keeps food in place, while the pancreas, the organ that produces digestive enzymes, also works more efficiently without being compressed, supporting a smoother breakdown of nutrients. A digestive system that runs smoothly each night not only makes you wake up feeling lighter and more comfortable, but also lays the foundation for long-term health. A stronger immune system, a more positive mood, and a significantly improved quality of life. Beyond the remarkable benefits for digestion, heart health, and detoxification, sleeping on your left side also brings a very practical benefit that many people do not expect, reducing snoring and improving sleep apnea symptoms. Snoring happens when airflow through the breathing passages is obstructed, causing vibrations of the soft tissues in the throat. Sleep apnea, on the other hand, is a condition where the airway becomes temporarily blocked, causing the person to stop breathing for several seconds or even minutes, multiple times throughout the night. These interruptions prevent the body from entering deep sleep, reduce oxygen levels in the blood, and increase the risk of heart disease, high blood pressure, diabetes, and stroke. Importantly, sleeping position directly affects the openness of the airway and the ease of airflow. When lying on your back, the weight of the tongue and soft tissues tends to fall backward, narrowing the airway, which can trigger loud snoring or brief apnea episodes. In contrast, sleeping on your left side allows gravity to pull the tongue and soft tissues away from the airway. The trachea opens more fully, air flows more smoothly, and snoring and sleep apnea risk are significantly reduced. Sleep medicine experts recommend that patients with sleep apnea practice sleeping on their left side as a natural support method, in addition to using respiratory support devices if necessary. Several clinical studies have noted that the left side sleeping position can lower the frequency and severity of nighttime apnea events, greatly improving sleep quality and daytime alertness. Reducing snoring benefits not just yourself, but also your loved ones, helping everyone enjoy deeper, more restful sleep and fostering family harmony and happiness. A peaceful, full night's rest is a priceless gift everyone deserves, especially as we get older. As you can see, simply changing your sleeping position to the left side can bring peaceful nights and more energetic mornings, not just for you, but for your family too. Although sleeping on your left side brings many wonderful health benefits, it is important to acknowledge that it may not be suitable for everyone. First, individuals with severe heart conditions, especially those with end-stage heart failure, should be cautious when lying on their left side. In some cases, this position could cause more blood to return from the lungs to the already weakened heart chambers, increasing the burden on the heart and worsening symptoms of shortness of breath or fatigue. Some patients may feel uncomfortable lying on their left side and may need to choose a different position or use specialized support pillows as recommended by their doctors. Next, people who have undergone stomach surgeries, such as gastrectomy, or gastrointestinal reconstructions, or chest surgeries, such as heart or lung surgeries, should also be cautious. Anatomical changes after surgery may make pressure on certain organs unusual, and in some cases, sleeping on the left side may not be the optimal choice for recovery. Additionally, those with other complex medical conditions, such as pleural effusion, diaphragmatic hernia, or those in the recovery phase after accidents, should consult their healthcare providers before adopting this sleeping position regularly. The most important thing I want to emphasize to you is every individual's health is unique. While sleeping on the left side offers general benefits for most people, if you have serious underlying health issues or experience any discomfort when trying this position, be bold enough to discuss it with your doctor to receive personalized advice suited to your specific condition. Smart healthcare is not just about following general advice, but also about listening to your body and making choices that fit your real situation. Seeking professional medical advice when needed is one of the best ways to respect and love yourself properly. If you are not yet familiar with sleeping on your left side, do not worry. Just like any other habit, your body simply needs a little time to adjust and adapt. With a few simple tips, you can absolutely train yourself to make sleeping on your left side a natural reflex every night. First, try placing a body pillow or a thick pillow behind your back. This pillow will act as a soft wall, preventing you from unconsciously rolling onto your back while you sleep. With support from behind your body, you'll find it easier to maintain a stable left-leaning position throughout the night. Next, you can place a small pillow under your right knee. This not only helps keep your hips and spine aligned naturally, but also increases comfort and reduces pressure on your lower back. Particularly helpful for those who often suffer from back or hip pain. Additionally, if you find it difficult to maintain a full side-lying position, you can sleep on a slightly inclined wedge pillow, which naturally tilts your body to the left without feeling restrictive. Some specially designed support pillows for pregnant women or people with spine issues are also very suitable for this purpose. Remember, at first your body might feel a bit unfamiliar or uncomfortable. This is completely normal. Based on the experiences of many sleep specialists, after about 2 to 3 weeks of persistence, your brain and body will automatically memorize the new position and make it a natural part of your nightly sleeping habits. A little patience and a little more self-love, that is all it takes. Step by step, you are building for yourself a healthier, deeper, and more fulfilling sleep routine each and every day. And now, as I promised, from the beginning, let us move on to an incredibly fascinating truth that science has recently revealed. The habit of sleeping on your left side may be linked to longevity. Preliminary studies tracking sleep behavior and long-term health have shown that individuals who maintain a left-side sleeping position during deep sleep stages tend to have higher healthy living indexes, meaning significantly lower rates of cardiovascular disease, Alzheimer's disease, and stroke compared to those who sleep in other positions. This could be explained by all the positive effects we have explored together. Optimized blood circulation, enhanced brain detoxification, reduced cardiac stress, improved digestion, and better lymphatic flow. All of these small factors accumulated over the years contribute to building a stronger and more resilient body. However, it is only fair to point out that science has not yet definitively proven that sleeping on the left side alone can extend lifespan. Health and longevity are still the results of a combination of many factors: diet, exercise, mental health, and overall lifestyle habits. Nevertheless, choosing a suitable sleeping posture is certainly an important piece of the puzzle, quietly protecting your body every night. Therefore, a small change, a simple habit like choosing to sleep on your left side, could very well be the first step toward a healthier, lighter, and more vibrant future. If you found today's information useful and believe it could bring positive changes to your life, please hit the like button to help spread this knowledge to even more people. I would also love to hear your story. Have you ever tried sleeping on your left side? How did you feel about this small change? Please leave a comment below to share your experiences or thoughts. Who knows, your sharing might inspire many others to begin their journey toward better health from simple everyday habits. And do not forget to subscribe to the channel and turn on the notification bell so that every week we can continue exploring more secrets about living healthily, peacefully, and truly happily together. Thank you for staying with me until the end of this video. I wish you a good night's sleep, a vibrant, energized body, and a bright future starting from today's small but powerful habits.